Last month, Quebec released a province-wide survey on homelessness. It showed that the number of people experiencing homelessness nearly doubled between 2018 and 2022. But advocates say the data doesn't go far enough. They say we need to know how many homeless people die every year. Anthony Nerestan joins us now with more. And Anthony, advocates say knowing how many homeless people die and why could save other lives.
They say if you know the numbers and you know the reasons why people are dying, then you can spot certain trends and you can put in place measures to prevent other deaths and save other people's lives. And I went to Projet Autochtone du Québec, a downtown shelter for Indigenous people, and staff there say that they collect their own data about their own clients who have died as well as the cause of death. And, you know, they have the information on hand. The problem, Deborah, is that they say they have no one to share it with at the city level or at the provincial level. So the data is just sitting there. And they say that when you have this kind of information and it's not being made public, it's almost like you're flying blind.
I would think at the municipal level that they would want that population data, again, to know in terms of deaths of the homeless, people who are homeless. How does that compare to the number of deaths in the general population, the age that people are dying from, the things they're dying from, in order to design better programs and services.
Deborah also spoke to Caroline Leblanc. She's a PhD candidate at the Université de Sherbrooke who studies the living conditions of people experiencing homelessness who don't have access to shelters. And she says Quebec not keeping track of their deaths sends the message that they don't matter.
On collecte des données au niveau des indicateurs socio-économiques. On va collecter les décès des cyclistes, des piétons, mais on ne comptabilise pas les gens qui meurent dans la rue.
Okay, so the province isn't collecting this data right now, but is there a plan to perhaps do so?
We reached out to several ministries first to figure out if there was some data kicking around that just wasn't being made public, and that's not the case. And when we spoke to the health ministry, they didn't specify whether this was something that they were looking into doing.
All right, but is it being done elsewhere in the country?
Yeah, so there are two places that we know of in British Columbia and the city of Toronto. In the case of BC, they mainly go through coroner's reports and try to identify people who died without a fixed address. So there are some limitations with that method. And in the case of Toronto, they use several sources, including an online form that community groups can use to submit the names of someone they know has died. Again, it's not a perfect process, but the people behind it, Deborah, say the information has been invaluable and it's helped them get ahead of certain trends, including the increase of overdoses.
Tracking this data and where individuals are passing away, even specifically where in the shelter system individuals are passing away, has allowed us to intervene and concentrate additional healthcare resources to those particular programs, including and up to the deployment of safe consumption sites within a shelter environment.
And Deborah, people who work with people experiencing homelessness here in Quebec also get the sense that fatal overdoses are on the rise here. They just don't have the hard data to back that up.
All right, Anthony Nerestan, thanks so much.
Thank you.